Hi, welcome to Overcoming Roadblocks to Stuttering Therapy. My name's Elise Lambeth, and I am a speech language pathologist at Seattle Children's Hospital, and I specialize in working with kids and teens who stutter. I'm going to be covering a lot of information, so if you have any questions about anything that I talk about, please feel free to email me. My email is right here on this first slide. All right, so before we get started, I just wanted to go over my framework for stuttering therapy. So this is called Fluency Lanes. It's a framework for thinking about stuttering therapy that Melissa Coakley from the University of Washington created, and the two of us have kind of like played around with it over the years. And the main idea is that in stuttering therapy, we're trying to help the child or the client say what they want to say, and it's kind of like driving where you have different lanes or options that you can choose, and none of them are good or bad. They just all have advantages and disadvantages. So what we try to do in stuttering therapy is help kids get to saying what they want to say as much as possible. And maybe some kids will come in and they'll only be not talking, stuttering freely, or avoiding. Those might be the only lanes they have access to. So then we would try to help give them tools or help them have tools so that they can manage tension in the moment or use a pattern for talking so that they could speak in a rhythm that make it easier for them to talk overall. But those are all different choices that they can make, and there's no right or wrong in any certain moment. Even not talking, so sometimes we might think that not talking is bad. But if I asked a question right now, a lot of you would not respond because you didn't want to. You wouldn't want to unmute yourself and say something. So, not talking is a choice that all of us make sometimes. The thing with stuttering is you just have to realize like the more I don't talk, I might create more fear about jumping into the lanes and talking more. And I might become more and more isolated. Stuttering freely is another option. So the advantages would be that you feel more comfortable with your talking, that stuttering is just what their bodies do naturally, and so that it's no extra work. The disadvantages might be that they can't say certain things that they want to say or might not be communicating as effectively as they want to. Um, the advantages of using strategies would be that you can address the tension in the moment. The disadvantages are the amount of work or effortfulness or how strange it feels or sounds. And then a fluency pattern would change the overall way that you're talking, kind of like stretchy speech or a prolonged speech pattern or continuous phonation. And that is something that would make you a lot more fluent, but would really be a lot more effort and change the authenticity of your voice as well. And then avoidance, sometimes we think of that as negative, but it doesn't help to avoid and then feel shame about your avoidance. So, with avoidance, what we like to talk about are, again, just the advantages or disadvantages of it. So, of course, if you can find a way to get around tension, and tension is something that's making it harder for you to talk, of course you'll avoid sometimes. But just realizing the disadvantages to that, that you're not saying what you want to say, that it might come out strangely. So I had a talk that I went to at the National Stuttering Association convention where a young man was a teacher for Teach for America, and he taught math in an inner city middle school, which is a super tough speaking situation. Um, and he was saying that he doesn't understand like when he chooses to avoid and when he doesn't. So one time he was ordering at a taco truck and he ordered a chicken burrito instead of a super chicken burrito because he got stuck on the S, and so he just avoided. And the whole time he was eating his regular chicken burrito, he was like, "Oh man." But it's good if those things happen to be like, oh, of course I did that. That was a hard situation, and to have grace with yourself so you're not heaping shame on top of the fact that you avoided something that you wanted to say. And kind of in conjunction with that, in therapy, I talk a lot about communicating effectively, and this can mean a lot of different things. the most basic outline that I use to help kids try and figure out if they communicated effectively is to look at, did they say what they wanted to say? Were they understood? Were they interesting? And were they appropriate? And were they being a good listener? Um, so that's kind of the basic framework, and we'll do different speaking challenges and then go over that and see if they feel like they communicated effectively. Another thing that I love to do is just have kids talk about people that they think are really fantastic speakers, or we'll watch a TED talk, or we'll go to the Toastmasters website and they have like a list of 100 things that make you an effective speaker, and then the kid picks out a few of those things that they think would make them a more confident and effective communicator. And then you can do different challenges where they have listeners scale how well they did on those different things. So this is for a kid that I see for therapy, and he loved doing magic tricks. So he did magic tricks for different people and had them rate how well he did showing his knowledge of the material with pacing, with appropriate loudness, and with jokes rather than fillers. And so you can see none of these directly targets fluency, because you can be a really effective communicator and an amazing communicator and stutter, and you can not have a stutter and still have a hard time being an effective communicator. So these areas that he pulled out are things that most of us could work on. All right, so the first roadblock that we're going to be talk about is what causes stuttering. And this is usually something that comes up in the evaluation, and it's a question that I know a lot of therapists dread. So what do you say when a parent asks you what caused my child stuttering? Um, the first thing that I want to say is that if you say, well, we don't really know what causes stuttering, you do a real disservice to the amount of research that's been put into this very question, which there's been a lot of research into what causes stuttering. And a more helpful answer is that there is not a single cause for stuttering. They haven't found a single cause for stuttering, but it's a multifactorial disorder, and it's a motor speech disorder that's impacted by emotional regulation, language formulation, um, and genetics. So if we look at these factors, about 50%, at least 50% of cases of chronic stuttering have genetics involved, and they've identified 4 genes so far that are involved in stuttering. Um, and in twin studies, monozygotic twins have a higher incidence of stuttering than dizygotic twins, and the heritability estimates range from 50 to 70%. So genetics is a component of a lot of kids stuttering. Um, Oh, and along with genetics, actually, so there's no evidence that stuttering is learned. So sometimes I've heard of cases where adoption agencies or foster agencies are nervous about placing a child in a family with someone who stutters, but there has been no evidence from research that like adoption research, that shows that stuttering can be learned. Sometimes parents are concerned that their younger child is learning stuttering from the older child. And what I would say is usually 2 things. First, um, because of genetics, there's a higher likelihood that if one child stutters, that another child would stutter. The other thing is that younger children naturally imitate the child, but that doesn't mean that they're going to stutter and have stuttering as a difficulty. Um, Language is another piece. So, language organization and formulation plays a piece in stuttering, and kids who have language disorders have a higher likelihood of having chronic stuttering. Also, kids who have really amazing language skills and average to below average motor speech skills are more likely to continue stuttering as well. And one thing they found is that kids who stutter, most of us formulate language on the left side of our brain, but kids who stutter use both hemispheres and use their right hemisphere more heavily when they're doing language formulation. So I tell kids who stutter that they have a superpower. While most of us can only use the left side of our brain for talking, they are using both sides. The downside to that is that they're more likely to have tension. But one of the reasons that I love working with stuttering is that the kids that I see are super verbal. They have great language skills typically, and they are very creative and just really amazing to work with. So we talk about all the advantages to the way they think and how their brain works, and then the disadvantages that they are more likely to have tightening. Motor speech skills are different in kids who stutter. So there's a difference between like initiating motor speech movements and also auditory feedback and its connection to the motor speech movements. Um, so psychological issues do not cause stuttering, but and there's not a higher incidence of psychological difficulties within the community of people who stutter compared to outside the community of people who stutter. At the same time, if a child has anxiety or has perfectionist tendencies or has certain dispositions, they've been found to be more likely to continue to stutter. Reactability is another one. So emotions and emotional regulation play into stuttering. Kids with ADHD, there's a higher incidence of kids who stutter who have ADHD than the general population. Also, parents do not cause stuttering, but high-paced environments and competing for talking a lot are things that can bring out the stuttering, though they do not cause the stuttering. And finally, they found that people who stutter, both children and adults, their brains their brain structures are different, the percentage of gray matter to white matter, and the functioning, like how their brain works, is different. There was an issue in the Journal of Fluency Disorders last year that covered all of the newest neuroimaging research that's been done, but they're doing a lot of neuroimaging research right now in stuttering, and they found that there's not a lot of consistency across the studies in the findings, but one thing that's been consistent is that there's reduced excitability in the motor speech areas prior to speech production in kids and adults who stutter, and the motor thresholds and their increased motor thresholds and decreased cortical excitability. Um, Suggesting that it's difficult for adults who stutter to initiate movements. And it appears that the left inferior frontal gyrus and right auditory regions play an important role in the disorder, with anomalies in the gray and white matter, like we talked about. And if you're interested in any of that, please feel free to email me. But there's also, at the end of this slide, there's a bibliography that includes some of those studies. So here's some helpful points from that. Stuttering is not caused by parents. Talking about stuttering does not cause stuttering. Psychological issues do not cause stuttering. There's many factors that contribute to stuttering. And there's been a lot of research devoted to the causes of stuttering. So it's just not this black box that we have no idea what caused it or how it works. Each child is a unique combination of those factors. And effective therapy does not require knowing all of the factors for an individual child, thankfully. And stuttering is tension in the parts of the body that are used for talking. And so we can work on that tension regardless of what factors brought the child to the point of having tension. All right, so let's move to the next roadblock, stuttering through the Fluent Lens. So most of us who are speech therapists do not stutter, which means that we look at stuttering through the lens of a person who is fluent, and that can lead to many unhelpful and sometimes harmful obstacles. One being that we value fluency, and parents can do this too, where we're like, fluency is the most important thing. We want you to be fluent, and that places less value on authenticity and ease, which a lot of the kids and teens that I see obviously value a lot. So we're saying, oh, your stuttering makes me feel uncomfortable, or I'm worried about your stuttering, so I want you to make yourself more uncomfortable so I feel less uncomfortable. I want you to use your authentic voice less and put more work into talking, even though talking is already difficult for you, so that I hear more fluent words. And so that can leave a child with a sense that they're broken, that there's something inherently wrong with them and wrong with the way that they talk. Um, and that encourages avoidance. So they start avoiding talking, they might avoid certain speaking situations or start to put limits on themselves. I remember we during our first teen summer camp, one of the campers was like, "Oh, I'm fine with my stuttering. Stuttering's fine." But then we created memes, and his meme was a person who stuttered like giving a speech for a graduating class, and he was like, "People who stutter shouldn't do this," or "You wouldn't think people who stutter did this." And so even for kids who say like, "Oh, it's fine, everything's fine," they might be setting limits on themselves and what they're capable of doing because we're telling them that fluency is more important. Um, Above that is viewing the SLP as the expert, and I think this is really easy for us to do uh, because we think, oh, well, we've had a class on stuttering and I'm fluent, and so I must be an expert on being fluent. So I'm going to be the expert telling you what you need and how to do it. When really, stuttering is very individualized and unique for each person, and each child and teen and adult's goals and the speaking situations that are hard for them are going to be different. And so we really need to value them as the expert on their own talking and their own goals and their own avenues to reaching communicative effectiveness and saying what they want to say when they want to say it. Also, seeing stuttering through the fluent lens can support covert behaviors. So if we're just praising fluency, then the child might hide more and more their stuttering. And I have a friend who stutters, who her family didn't even know she stuttered all through high school. Or I was doing an evaluation and I said, "Does anyone in your family stutter?" And the mom was like, "No." And the dad said, "Oh, I stutter." But his wife of 10 years did not even know that he stuttered. So we don't want people to feel and kids to feel like they have to hide themselves. I think there's a lot of research coming out in many different areas showing the psychological toll that it takes on people when they aren't allowed to be their authentic self. And it also leads to praising the natural ebbs in stuttering. So, stuttering is cyclical, there's natural cycles of increased stuttering and less stuttering. And looking at stuttering through the fluent lens can cause us to be like, wow, you're so fluent. Wow, today you're really getting better. You're so much more fluent. And the kids that I see really hate this. And it sounds maybe even surprising to you that I say that, but that's just because they know that it's not anything that they're doing that's made them fluent on that day or fluent for that week or even a month. It's because it's just part of that natural cycle that their body goes through. And so that means that in a little while they're going to have the stuttering back and then they'll just disappoint everybody even more. And so that's something to keep in mind, but that's something that we don't naturally intuitively think of when we're thinking about stuttering through the fluent lens. We can use charged words like good, bad, better, problem. So if I say, "Ooh, that was really good," every time they're fluent, then the underlying insidious message is that when I normally talk and I stutter, that's bad. So just thinking about the wording that we're using when we're working with people who stutter. And also, it can encourage them to just tell us rainbows and unicorns, like, everything's wonderful. I love my stuttering. And some kids might love their stuttering, but really, we should want them to talk to us about difficult truths rather than just like telling us what they think we want to hear, because then we can help be an ally through those difficult times and help them and support them through that. So on the right side of this slide, you can see there's different resources for getting an opportunity to hear about stuttering from people who stutter. So Stutter Talk podcast has hundreds, if not thousands, of interviews with people who stutter talking about their experiences. You can go to friends conferences, National Stuttering Association support groups. What I will say is if you're going to go to a support group, you need to contact the leader, and some support groups want speech therapists to come and observe and others don't, which you can respect because it is a group not for teaching speech therapists. The primary goal of support groups is to provide support to each other. So I was talking with a couple people who stutter recently, and they were saying like this time where people who stutter are having to use Zoom and video conferencing a lot has been challenging for a lot of people who stutter because telephone calls and video conferencing can be even more difficult than in-person talks. And they said that they'd gone to a couple support groups and there'd only been people who stuttered there, and it was great to just like have a chance to talk through that with other people who stutter. That being said, most support groups are really fantastic about wanting to help educate speech therapists to be more supportive of people who stutter. When you go to a support group, though, just remember, do not talk unless someone talks to you or asks you a question directly, because again, the focus is not you, it's on them and having their time, and you're just there to listen and kind of learn. Also, Say has a My Voice video series that talks about different people's experiences with stuttering. The Stuttering homepage has great articles written by people who stutter. There's TED Talks by people who stutter. Um, there's panels of people who stutter. You can go to coffee with someone who stutters. There's awesome documentaries. We showed one here at Seattle Children's in December that was really powerful. There's books written by people who stutter, magazine articles written by people who stutter, and then there's a really awesome series through the National Stuttering Association that talks to different people who stutter across a wide variety of careers, which is really cool. So, what's the difference if we approach stuttering by valuing and centering the lived experience of those who stutter? It can lead to understanding and empathizing with the people that we're working with, tailoring therapy to fit the client's goals and needs rather than what we think would be best for them, helping the client say what they want to say when they want to say it, and then instead of building like hiding and worrying and avoidance, we're helping build resilience and confidence by having them do challenges and be comfortable with their own voice and try speaking situations that they've been avoiding or afraid of, and give them support through the times where it doesn't go the way they would like to and the times that it does. One thing, a lot of the kids that I see will feel like a certain situation would be so horrible that they would die. Like ordering at a restaurant can be one of those things. So I'll take them and we'll go and order at Starbucks, and they'll be sure that they're going to die if they stutter and do it, and they stutter and they have a hard time getting through it, and the person asks them, what did you say, maybe several times, but they get through it, they get what they wanted to order, and they didn't die. That's like the first thing they say, like, I didn't die. And I'm like, yeah, you didn't die. So we're building that resilience and confidence through desensitization and experience. You're partnering with the client through the ebbs and the flows instead of just praising when it goes down. You're helping them when it goes up and down. And you're reframing thoughts and actions into helpful and unhelpful instead of good and bad. Describing experiences rather than labeling them. So, how did that feel? What was going on in your body? Instead of that was good, that was bad. Helping them understand what they're experiencing, and choose options that help them towards their goals. All right, so some helpful points about that. You want to talk less and listen more. Listen without judgment. Don't lead when talking to clients about feelings. Every person who stutters is unique, but there are threads of commonality that help clients feel less alone and normalize experiences. A good example of that is saying your name is something that's hard for a lot of people who stutter, but it's also something that a lot of the kids that I see will feel like they're the only one who has a hard time saying their own name. And so just hearing that other people have had that experience helps normalize it and makes them feel less alone. Seek out opportunities to listen to people who stutter talk openly about their experiences with stuttering. Don't equate your fluent experiences, so a hard speaking situation that you had, with what it's like to stutter. And just asking your own clients about their experiences is not enough perspective. One, because you kind of hold a position of power over them, like they have to maintain a good relationship with you because you're going to be seeing them ongoing week to week. But also, sometimes adults or people who come from different backgrounds can share experiences that help us understand what it must be like for our clients. And so it's great to hear perspectives from a lot of different people. One of my friends who stutters said, like, if you know one person who stutters, you know one person who stutters. So stuttering is really unique, and it's good to hear as many perspectives and experiences as possible and to treat each child as a unique individual. This is a poem that one of the teens that I saw wrote that kind of describes her experience of stuttering. And she was covert, so most of her friends did not even know that she stuttered, and her family didn't realize the extent of her stuttering. Tick, 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 boom. They say it's not that bad. It's barely even noticeable. It's classified as minor, just a minor flaw. But what is insignificant to them is a war within myself. They see a single sniper, but I face a full blown army. Speaking is a struggle when you have a stutter. My teeth, a battalion, my tongue, a blockade. Every faltered word is a fresh flesh wound. Each stammered sentence, a ticking grenade, never truly knowing when it will blow up in my face. My muscles clench as a bead of sweat escapes down my forehead. I try to force my mouth to cooperate, but it's battling against me. Bystanders watch as the battle treads on, unable to help, not knowing how to react. Eventually, I just stop fighting. Barricaded by my own soldiers gone rogue, I surrender. I stop talking. So I think that gives like a little view into what it is like to be a covert person, a person who's covertly stuttering, so hiding their stuttering and trying not to let anyone know that they stutter. Which kind of segues into our next big roadblock, which is big emotions. And this is actually how I started specializing in stuttering, is that I had a family where the mom and the child would cry every time they came into therapy, and I just didn't know how to approach or manage their emotions that they were feeling and help them through that, or not get overwhelmed with emotion myself. And so I started looking more and more into strategies and techniques to help families with the big emotions that they feel around stuttering. And I kind of found tools in 4 different areas. So assessing emotions and attitudes, understanding emotions and attitudes, desensitizing towards stuttering, and addressing emotions and attitudes. So the first tool that I use a lot in evaluating emotions and attitudes is scaling, which we'll talk about in a little bit. I also use a hierarchy of speaking situations. I always have a lot of blank paper with me, and I like to write and draw things out. So what I'll do is I'll just draw a ladder, but you could also have a form. There's lots of forms of this where you have a ladder and then write out speaking situations that are important for that child. So there's ones that are common, like speaking to friends and family, ordering at a restaurant, but there's also ones like certain kids will give presentations for 4-H, or I have had kids that play a lot of Fortnite, and so they use headsets a lot, and so that's a different speaking situation. So you kind of tailor it to each individual person that you see and kind of rank speaking situations. I'll also ask younger children questions in play. So we'll be playing a fun game, and I'll say, "Do you ever have a hard time saying what you want to say? Do your words ever get stuck?" And I'll just ask a few questions. And sometimes they'll be like, "No, I have no idea what you're talking about." And other times they'll have created a whole story about why they have a hard time talking. Like one little girl that I saw thought that she drank too much water, and it's caused her to start stuttering. And that if she was a good girl, she would have less stuttering. And her parents were just amazed because they had no idea that she had created all these thoughts around stuttering. A more standardized or a more formalized measure is the overall assessment of speakers' experience of stuttering, which you can give and then give later on and assess progress over time. You can also get the communication attitudes test revised, which is like a school age scaling assessment that you can get for free online. I think on Fluency Friday website they have a copy of that. There's also the great book, The School Age Child Who Stutters: Working Effectively with Attitudes and Emotions. That's available through the Stuttering Foundation, and that has a lot of great pen and paper tasks that kids can do so you can get some insight into how they're feeling about their stuttering and their emotions. Kids drawing pictures of themselves talking can be really helpful. So I've had kids draw pictures of their talking, and then there'll be a whole bunch of like Star Wars people attacking them with lightsabers. So you can just kind of see, you get a sense when you're looking at the picture that talking is kind of a battle for them. Um, get and this one I don't do as much as I used to do just because I like to be authentic and honest with kids, even in little ways. But you can also get stuck on a word like, what? Oh, I got stuck. Is that okay? And I've had some kids say, no, that's not okay. Like, don't do that. And then you get a lot of insight into how they're processing and thinking about times when they're getting stuck. All right, so then we're talking about understanding emotions and attitudes. I think all of us are kind of familiar with the iceberg analogy, and for stuttering, Gary Rensselaer kind of created this graphic where at the top we can see blocks, repetitions, prolongations, secondary behaviors. And if we're talking about covert, so if you're hiding your stuttering, you might not see anything above the water surface, and then underneath all the unseen things are the things that the child or adult is processing. So fear, shame, guilt, embarrassment, avoidances, switching words, all of those things are kind of under the surface. It's helpful for understanding stuttering if kids watch themselves talking and stuttering, which can be something that's kind of tricky for them. And I will say, so I have this separated in categories, but these categories are also very intermingled. So watching videos of themselves talking is also very desensitizing, and it can also help them address some of their attitudes and emotions towards stuttering. We talk about the cognitive behavioral cycle, which we'll talk about a little bit later, analyzing previous speaking situations and talking about what was difficult and why it was difficult or what went well, listening to other people talk about their experiences with stuttering, which can be really powerful. Sometimes the kids that I see can't access their own feelings towards their stuttering, but if they hear someone else talking about it, then they can tell you what they identified with and what they didn't. So now let's move to desensitizing to stuttering. One of the things that I love to do that, again, I got from Melissa Coakley and I've kind of like modified the form a little bit is doing communication challenges or speaking challenges. And I want to share. So this is kind of what these look like, and I love to do this. This is an example of what one of the kids that I see filled out. So you pull up this communication challenge form and you say, what do you want to do? This teen wanted to talk to a stranger and use his regular talking voice and then use a pattern if the person didn't understand, because he tended to talk really quickly to avoid stuttering, but it actually decreased his communicative effectiveness because it made it harder to understand him. And when I asked, how do you think it will go? He said it would be messy. Because when I ask for help, I have to know what to say and explain it, and they'll be stuttering, and they might have difficulty hearing me. And if I have to repeat myself, it's hard because I stutter more when I repeat, and the other person is really focused on me. So there's some negative predictions about how that's going to go. And then you judge how likely are you to complete this challenge. You want an 8 or higher, and if it's not an 8 or higher, then you modify the task to make it more likely that they'll finish it. One of the things that I always like to put is for determining success is that you tried it. Wow, that's great. That's a great victory. And then also, this teen said he wanted to not let stuttering get in the way of communicating, and he wanted them to understand him. All right. All right. We also list out the advantages and disadvantages of stuttering. This is something that in the Seattle Summer Stuttering Camp that Seattle Children's Hospital does in conjunction with the University of Washington Speech and Hearing Clinic. This is one of the activities we do, and the teens really love it. Certain teens just really connect with this because they like realizing that their stuttering has brought some advantages. Like some teens have said, it's like a friend filter, so they're not friends with any jerks, and they're better listeners and more empathetic, and just realizing that they love who they are, and part of that has come from their stuttering. We also write out the things that a child's good at and the things that are difficult for them, and emphasize that everyone has things that are difficult for them. It's great to go to friends workshops, support groups, conventions, so that kids can spend time around other kids who stutter. Researching famous people who stutter. The kid that I talked about in the example who would cry every session, it was like a super big turning point for him when he realized that there were famous people, successful people who stuttered, and especially like Joe Biden was vice president at the time, and he's like, Joe Biden stuttered? Oh wow, I'm gonna be fine. Like it's gonna be fine. It was a big turning point for him. I also play a game, two facts and a fake, where we say two things that are facts about stuttering and a fake thing, and they have to guess, and you can do it about things about yourself too. And then doing a presentation for class on stuttering is really powerful. I had a kid who was being bullied pretty terribly. And one of the things that we did was go and talk to his class about stuttering and educate them, and educate the whole class about standing up if they hear anyone teasing or bullying around anything, but stuttering in particular, and he never had a problem with being bullied again. Some of the other great desensitization activities that I love is pseudo stuttering. This is a hard sell. Like the kids and teens that I ask to use pseudo stuttering are like, no, thanks, hard pass. Like I'm not gonna do that. But when they try it, they realize it reduces reactions to feeling of tension, so they don't panic when they start to feel tension. It gives them an increased sense of control, and it allows them to analyze the listener's reaction. So in a moment of stuttering, they might not be able to like take a step back and kind of think, how is the listener reacting? Instead, they'll just think, oh, they're so annoyed at me, this is going so terribly. But it lets them kind of analyze in a different way. Also, FYIing, which is also called advertising, when you tell other people that you stutter. This is another one that's hard. Kids are like, I don't think so. But when they try it, it helps them feel reduced pressure to hide their stuttering. One thing that kids will tell me, I'll be like, Elise, I'm not doing that. I'm not gonna be like, hi, I stutter as soon as I meet somebody. And I would not recommend that either. Like, do not tell people you stutter that way. But you can kind of use it, like if you can pseudo stutter and then put that in, which I've worked on with some kids in activities like ordering at Starbucks, where they'll get stuck on the order like ah, 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 ah. And then they'll say, oh, just so you know, sometimes I stutter, just give me a second and I'll work through my tension. And then they'll say, I want a hot chocolate. And that also opens the opportunity to discuss reactions to stuttering moments, and it can reduce the stigma around talking about stuttering for the person that you're talking to too. um, One of the things that I love to do with the kids that I see with regards to desensitization is have them create memes or TikToks about that educate people about stuttering, or that express some of their feelings about stuttering. So this one on the side, stuttering is cool, like this was one that a kid did. This kind of talks about that feeling that they have when they block, those strange looks people will give them if they tell them they stutter, and they're like, no, you don't stutter, which drives some of the kids that I see crazy when they're like, I do stutter. Like, you don't have to insist that you stutter, so don't tell people like you don't stutter. um, don't finish sentences. The feeling when someone asks them if they forgot their name. The feeling when they have a really fluent day. When someone tells them that stuttering's not so bad. Again, when someone finishes sentences. This kid, it's interesting. So you can see how you can get some of the attitudes and emotions that kids are having from the art that they create. So stuttering is okay. It doesn't matter no matter what people say. So obviously he had had people say different things to him about stuttering. The feeling of not being able to get your name out, when you get stuck on hamburgers, so you order spinach instead at a restaurant, when you actually use your speech tools. So these are like really great ways of getting insight. It's helpful for the kid and the teen to express those things, and it's also helpful for them to see other kids expressing things that they identify with. So naming emotions can be really powerful. That kid that was bullied that I saw for therapy, was like, "Oh, it's okay." He was getting really terribly bullied, and he was like, "Oh, it's okay." And I was like, "No, that's not okay. That's not okay that anyone would treat you that way. And that makes me feel angry." And you could just see him like relax, like, "Oh, someone feels strongly about this. Like this is not right." And so even being able to name emotions you're feeling about what they're experiencing or that they're feeling can be helpful. One of the images that we talk about is kind of a boat in between two shores, and on one shore is an emotional desert where they don't let themselves feel things, and on the other shore is emotional chaos where they're overwhelmed by their emotions. And one of the teens that I saw was like, "Elise, when am I going to stop crying every time I come see you?" And I was like, "Well, you're talking about all these experiences with your stuttering that you've been hiding for years, and so there's all these emotions that go along with it, but the more you talk about it, the more you process those experiences, the less emotional chaos will go with them." And that was definitely true. And we talked about thinking about the logical sides or facts to kind of move away from the emotional chaos, but also letting yourself feel the feelings that happen from your experiences. And I learned about that through The Whole Brain Child, which is a great book that talks about different aspects of emotional regulation. Um, and I think all of us have probably heard by now that that idea of like flipping your lid where your amygdala takes over and is making the decisions for you because you're just emotionally flooded. So helping kids realize that their emotions are rising and making choices so that they don't flip their lid, which impacts their communication, and also their avoidance and ability and confidence. So we talk about the wheel of awareness too, that your brain can only think and process about one thing at a time. And so if you think about that with the cognitive behavioral cycle, that you can have key thoughts that you think about over and over again, and that those can lead to emotions that lead to changes in your body that lead to actions. So if they're like, "Oh no, I'm going to stutter," then they're going to feel panicked, worried, embarrassed, and their body's going to get tight, and they might get that feeling like they're in trouble. And then the action that follows, you have this freight train of thoughts, emotions, and body changes that lead to more stuttering, which can feed into that cycle like, "Oh no, I did stutter." And so we talk about taking those thoughts and trying to turn them into something that's more helpful but still true. So if they're telling themselves something that they don't feel is true, like, "Wow, well, I really love having a hard time ordering at a restaurant," um, then it's going to be less helpful than if they think of something that is true, but still, like, "No matter what, I will get what I want at this restaurant. They can wait until I'm finished." Or one of the girls I'm working with has been trying to tell herself, "People will still like me even if I get stuck," which she has been saying, like, "Oh no, I better finish what I'm saying or people won't like me." So kind of working on those thoughts and feelings and changes in the body and actions. And thinking about thoughts not as good or bad again, but as helpful or unhelpful towards helping you reach the goals that you have for communication. All right, so the next roadblock that we're going to be talking about is carryover. So this goes back to the scaling, and I've been using scaling and then the ICF framework kind of in conjunction together to get person-centered functional goals for the kids that I see who stutter. And so I'll write out a scale for them, with 0 being that stuttering's not interfering with their talking at all, and 10 being they can hardly get words out. And you just ask them to rate themselves on that scale. And this is good for kids. I've had some really aware kids that could do it as young as 5, but I would say normally kids who are 7 and older can do the scaling with you. So discuss what being at the number they stated looks like. And usually it's like a 4 or a 5 or a 6 that they'll tell you. Um, and ask them like what different communication situations are like how is it when you're talking in groups, how is it when you're answering questions in class and presentations, and you just kind of probe for avoidance and see if there's any avoidance that they're doing, and then ask them how they're managing stuttering at that level, and then ask them where they want to be on the scale, and then discuss like what would be different at that number, what would they be doing more of, so you can come up with small steps that you can take towards those goals and create goals that are functional for that child, which really help with carryover, because they're the ones that are driving the choices and the things you're working on, and it's all driven by them. I always tell the kids that I work with, like, I'm here for you. I know about different strategies and techniques and ideas. You tell me what you want, and we'll try to find paths towards that. The World Health Organization has a great framework, the ICF-CY framework, that looks at health conditions and the body functions and structures, that are involved in the activities and participation. And then which it's great that it looks at activities and participation, which is something that's usually pretty impacted with stuttering. And then you look at those and see what facilitators, to communication there are within the child or person themselves and the environment, and what barriers there are. So I've kind of created a form that helps me organize this. So if I do an evaluation, I'll get all this information from my standardized tests, like the stuttering severity instrument 4 and the oases, and then also the scaling that I've done and the case history and parent interview. And then I put all of that into this form to see, okay, what are the strengths and facilitators for communication? What are the barriers to communication? So this is just an example that I have written in here of a child who had a lot of different communicative difficulties. So this form kind of helps sort what the barriers are and what the strengths were. And so this child was very social, was very willing to talk and big talker, and had very supportive parents, um, but had a lot of speech and language difficulties. So then you can go to asking the parent like what their goals are for their child, and you're trying to again get more concrete goals. So they might say, I want my child to stutter less. But you want to ask more specific questions so that you can get concrete goals. So if your child was stuttering less, what would you guys be doing more of? What would they be able to do? And you want to get concrete things like, I want to have conversations with my child each day. I would like my child to be able to talk to her grandparents on Skype. I want my child to be able to tell me what happened at school. And if they focus on improving just a few things, like what would they like to work towards? So then you can include in your evaluation goals towards the child's goals and the parent's goals. And from the example that we said, the child wanted to be able to talk to people in stores and at school and be understood, and the parents wanted the child to be able to talk to friends and be understood and to be able to tell them about what she did during the day. And so then you take the information from that form and the family's goals, and with the strengths outlined and barriers, and you come up with small steps towards their goals. So realizing that it's okay if you don't speak perfectly all the time, because that means that sometimes you're stuttering more openly instead of using all that cognitive load to manage your stuttering. We discussed scaling so that you can practice a pattern, which we'll talk about in a minute. And then also talked about using a visual support to map out the day so that the child could tell narratives with a sort of structure in mind. All right, so then the next roadblocks are unhelpful strategies. So these are strategies that I hear a lot from kids or families when they come in for the evaluation. And I will say that if anyone saw kids that I saw, they would probably say that I had used some of these techniques with them, just because the idea of these techniques and strategies is out there a lot, even though I promise I've never I've never used any of these with the kids that I see. But it's just something that a lot of times if you tell a child something, they'll process it and think it's one of these strategies. So let's um, the first thing, so we'll dive into it. And the first thing that I talk to kids about are the speech helpers. So the parts of their body that they're using for talking, like their brain, lips, teeth, tongue, lungs, vocal folds. And we talk about how you use those in ways that are tight and punchy or ways that are loose. And I have kids draw out these speech helpers a lot, especially in the beginning, a lot and a lot. So they are thinking about where their tightening is happening and what's going on, and it can kind of demystify stuttering for them. And I introduce strategies by talking about, all right, let's do it really punchy. So if they get stuck when they're saying their name and their name's like Frank, then you would do it really punchy and you'd be like, okay, that's with our teeth and our lips, so we're gonna go Frank. And I sometimes parents are like, why are you having them do it punchy? And it's for a variety of reasons. One is that helps desensitize to that feeling of tension. Two, it demystifies it, like, oh yeah, I can make myself do that on purpose, so it's not just a mystery what's happening in my body. And three, it builds muscle awareness so that you know how to decrease tension if you know how to increase it. And then we'll do a light touch or open like singing, like Frank, and then a let it go, which is how I like to talk about pullouts because I think it's a great visual of like Elsa, like let it go. And if you sing that, then kids will never forget that strategy because they're like, oh, that was so annoying. All right, it's let it goes. And so we practice like you feel the tension and then you let it go in the moment. So the first less helpful strategy is telling kids to take a deep breath. If you take a deep breath right now, I think you'll feel like there's tension that goes across your shoulder and like a column of tension down your airway. And so, what I've found is a more helpful approach or strategy is to open like singing. So, instead of saying like, I like it, you would say, I like it. So the first thing is taking a deep breath makes you more tight. There's three other reasons this is not my favorite. The second being that it sounds weird. Like if I'm like ice cream instead of ice cream, it doesn't sound typical. The second is that a lot of kids will turn this into a secondary behavior. So their brain will be like, oh, it's the air that helps. So they'll go, I like it like that, and they'll start adding in these extra audible breaths. And then the third reason that this is not my favorite is that it doesn't address the tension in the vocal folds directly. It just has them breathe, which makes sense to us. Like if we're feeling tight, a lot of times we'll breathe, but we want active relaxation in the vocal folds. And so what I'll do is open like singing on vowels or H's. So for example, if they were saying ice cream first, it would be like ice cream. And some kids will go, oh, ice cream. And I'll go, wow, that's fantastic. All right, let's make it sound more like your own voice. And then you just make it shorter and shorter while having them still feel that their vocal folds open without popping open. Also, relax is a really loaded term because it can mean, oh, I feel so calm, like I'm on vacation, rather than actively loosening your muscles. So I prefer like talking and bringing the kid back to like what muscles are tightening. Let's loosen those muscles directly rather than saying relax. Um, so there's nothing wrong with stretchy talking per se, but it's not a be all end all of therapy. And also slow down is something that a lot of parents say, and it makes sense. It would help the child to slow down, but it's also as if we're fighting and I say, just calm down, just calm down. Like in the end, that's not a helpful thing to say. And it usually makes the child tighter and more frustrated. So what I like to do is use a weirdness scale. So we create a pattern of talking that helps the child be fluent. And again, this is not something they would use all the time. It's just one of the lanes that they could choose. And the pattern that I use would be composed of like having a rhythm for the talking using continuous phonation, even syllable delivery, and a light touch or open like singing on those first sounds. And you would start out super weird, and the kids name this pattern, and then you try to make it sound more and more like your own voice. So a 10, which I would be like, you would never talk to anyone like this. And I don't even usually make kids try a 10, I'll make them try like an 8. Is like, I really like to camp, like that. And then if they made it a little bit less weird, I really like to camp. And then like a 5 it would be like, I really like to camp. And then a 3 would be even more like their own voice, and a 2 would be like, I really like to camp, where they might be feeling a kind of rhythm, but you can't hear it as much. And the weirdness scale kind of incorporates two things: how strange it sounds and how effortful and strange it feels. So by the time that it gets down to like a 1 or a 2, you might not be able to hear that they're using a pattern, but it's still some effort for them. And it's kind of like those old fashioned stereo systems. Like if you're trying to be more fluent, then it's going to be weirder, and if you're letting your voice be more like your own voice, you're probably going to get some more tightening. And we play around with that. All right, so the final roadblock is atypical stuttering. Atypical stuttering is things like word final repetitions, and it usually comes at the end of a sentence. So they'll say like, or a phrase, I like to go to school, ool, ool. And there can be word breaks like what, d, ooh, y, ooh, the ink. Um, and then stuttering is characterized by repetitions, prolongations, and blocks that have tension. Cluttering is characterized by a higher than average use of fillers and revisions, non stuttering like disfluencies, and irregular or rapid rate. And so there are kids who have stuttering, cluttering, and atypical disfluencies. There are some kids that just have atypical disfluencies, or atypical disfluencies and stuttering, or atypical disfluencies and cluttering. So these can kind of co-occur. With cluttering and atypical disfluencies, there's a few things that I found to be helpful. And I kind of use this process, which Melissa and I came up with together too, Melissa Coakley. Name it. So you identify the behaviors impacting the ability to communicate effectively, and you contrast it with all together talking. Like, oh, that's really choppy. Let's see if we can make it all together. And then you come up with helpful strategies, which can be pauses. It can also be a pattern with a weirdness scale. And then you give it a memorable name that they choose for themselves, so it kind of becomes personalized. Like I had a kid call it jazz talking because he felt like he had a rhythm, and then he could put it all together, or you could call it all together talking. And then the final piece is that you practice that strategy with increasing linguistic hierarchy, making it sound more and more like their own voice and more natural for them, and you try it across different speaking environments. So in the clinic with you, when they're reading, when they're talking to parents, different situations like that. All right. And now there's a lot of local resources where you can find out more information about stuttering or participate. There's some really fantastic family and adult support groups in the Seattle area. We do an annual Friends One Day conference in Seattle. I run the Seattle Summer Stuttering Camp for Teens with Melissa Coakley from the University of Washington. There's also this, every other year, there's a Stuttering Foundation Western workshop in the area. And then the Successful Stuttering Management Program is an intensive program on the east side. So there's a lot of resources. And if you have any questions or you want to know more, please feel free to email me. Those are the references. Thank you so much for listening to my talk about overcoming obstacles to and roadblocks to stuttering therapy. Thanks.